Hey, this is the Live Life Aggressively show. I'm Sincere Hogan, got Mike Marlowe on the other line. Hey, man, how are you? We've been traveling a lot these last couple of weeks, man, so I know you just got back in.
Coming off a fun weekend. I went to see the band Soulfly with my good friend Dave Gunter, who's a big fan of our show, listens to it every week. And you ever notice that every drunk girl acts exactly the same?
Yeah, drunk. She loves you. She's slobbering. Her breath is kicking.
They always talk too much. They always think they're coherent.
And their voice is like 6 octaves higher.
And it's always extremely annoying and unattractive. Doesn't matter what their ethnic background is. Doesn't matter where it is. It's always annoying.
Right.
So we're at Soulfly. We have this little table. The band gets on. And this lady keeps looking over at me, and she goes, "Come on, man, get into it. Why aren't you?" She's like, "I can't tell if you're having a good time or not." I was like, "Well, why are you looking at me?" I was like, "Don't worry about what I'm doing." And she wouldn't stop. So finally, I was about to leave, and then I realized, okay, I think I can get rid of her using what the Buddha would call skillful means. And I was like, "Man, have you noticed the band keeps looking at you?" She's like, "Huh?" I go, "They keep looking at you. Go right there. Just go up front. Go up front." She's like, "Okay." She runs off. And that's the last we saw of her. Boom.
Oh.
See you later, biatch. That's just another night of Vegas. But every concert you go to, there's always a drunk girl, and they're all the same person. They always act the same. It's not a good look.
Well, usually she's right next to the drunk guy, too. So we're not going to let him get off, easily as well. He's that same dude. "What's up, bro? What's up, bro?" Looking at me. And then with me, "Hey, man, you got anything?" Like, God, like what? What do you? I'm like, I'm good. He's like, "Nah, man, Like, what, weed? No." Like, "Oh, I was just thinking, man, you had the dreads. I just figured you had some weed." I'm like, "No, man, I'm the squarest guy you probably going to meet."
Where you're at.
I got a foot.
You're real high.
Yeah, that's hilarious, man.
Yeah, but we saw Guns N' Roses a long time ago. It was a similar type situation. It was a guy, and he did the same thing. He's like, "Man, I can't tell if you're enjoying the show or not. I don't know if you like me or you hate me." I was like, "What the fuck is wrong with you, man?" It's like, why are you looking at me when we're at a concert? Anyway,
man.
Won't belabor that point. Just now, let's move on to some quick thank yous to a lot of our listeners who have been supporting the show. They're using that coupon code LLA, get 10% off the best nutrition products around, nutrition supplements. Let's see, we've got Corey Burks, Brian Watkins, Scott Peterson, Bill O'Leary, Jason Elliott, Audrey Powell, Abraham Bennett, Miguel Perez, Jacob Peterson, and Mick Moyer. They're all using that coupon code LLA to get 10% off any nutrition product, any product. Actually, you see it at my website, mikemahler.com. And how about over at your site, man?
Also want to say, give a shout out to Pat Watterson and Brad Koltek. Brad also, not only did he buy some product, he also became a Patreon supporter as well. And also to Kevin S. Helm. And also one more, as far as the Patreon is concerned, one more shout out to Mike Connell, who also became a monthly supporter on Patreon. So the names I mentioned before, they used that coupon code LLA and they got 10% off. And I'm starting to see a big increase now. I think they're listening to us, and when we're talking about we're getting into the holidays and not waiting to January 1st to start trying to take control of your health and pretty much just going out and just destroying yourself for the next 2 months with all the holiday parties and everything else and just eating like crap and thinking that you're going to save yourself on January 1st. Most of these purchases have been with my Weight Management 101 course. And hey, folks, do like these folks. Get on it. Hop over to newwarriortraining.com. Sign up for that course. Prepare yourself. And don't be that person. Like I said, don't be the New Year's resolutionaries over there trying to hop on January 1st and think you can fix all these years of crap that you've done to yourself all within a day or maybe a month. However long that 24-hour fitness free membership is going to last you. Because that's usually when it's over. Once the free trial is over, everybody's like, okay, I'm good. Going back. This is too hard. So I don't really, see that from our listeners anyway. They kind of know better because they know when we talk about that, it sucks to be that person that we're talking about. Kind of looking like, oh, God, they're talking about me. There they go. I mean, it's actually working for the ones who have their heads up their asses. You see a lot more of these heads are coming out for daylight that we talk about. When every time someone purchases something, they give us a little note like, it feels great to get my head out of my ass and actually support the show. And we appreciate it.
Yeah, what's funny is we're so hardcore. Some people feel like they have to apologize. Right? They buy something and then in the note notes section. Oh man, I've been listening for a year. Sorry for being that dipshit you guys talk about.
I was that guy, man.
Yeah, most shows they're so afraid about offending their audience, so they'll stop listening.
Right.
They're like the exact antithesis of that. They're like the Andrew Dice Clay of the podcast world. We go out of our way to offend people. We're flipping the script where now they're apologizing to us for not buying stuff. Instead of us having to apologize. Oh, you guys offended us. Like,
it feels good that people are offended that they offended us.
We're so sorry to offend you by listening to your show and not supporting you. So here's me buying something finally. I never respond to those people because why do you need to be acknowledged? It's like, just buy the product, man. You don't have to apologize.
We'll acknowledge you then. Oh, man. Right. So this is going to be a good one, man.
One last shout out. Dr. Peter Rouse, our friend who moved to Switzerland, I think. Was it Switzerland or Sweden? He moved to one of those countries.
Switzerland, I believe, yes.
Yeah, Switzerland. He moved there because he couldn't sleep in L.A. But anyway, he still has his gym in L.A., AF Performance Center, and he was letting me know that any member of the military will get 50% off memberships over there. So check that out. He has a really nice facility, great staff. So if you're a member of the military or anyone else, but if military in particular, go over there. Show them your military card, get 50% off. The
timing on that is great because at the time we're recording this show, it's almost Veterans Day, and today is actually the anniversary of the Marines. So happy birthday to the Marines, 240 years of kicking ass. Appreciate your service fellas out there and ladies. So we definitely appreciate that. So like I said, that's what's going down today as we're recording this show. So thank you for all you guys and ladies for your service.
Yeah, we have a great guest on today. He's a very well-respected plastic surgeon, and there's a rumor that the character Christian Troy in the show
I was thinking that.
That apparently this character was based after our guest today. It's a real-life story. So we have Dr. Julio Garcia. How you doing today?
I'm doing great, guys. Thanks for having me on.
It's good.
Appreciate it.
We had a little interesting talk before we started talking today. Before we started recording today, rather. And I think the whole field of plastic surgery is really interesting because when people think of it, they just think of pure narcissistic behavior, right? People just going in who are just not happy with themselves and they get addicted to getting surgeries. But it seems to be much broader than that, right? What percentage of people do you think fall into that category? And then what would you say are people that just want to feel better about themselves genuinely? They just need a little touch up. They're not addicted to getting surgery after surgery. They just feel like they need a few things.
Sure. Mike, it's a great question because I've been doing this now almost 28 years here in Vegas, and it's dramatically changed. When I first got here, it was exactly what you said, the last part, which is people just wanting a little thing. They wanted to restore what they had lost, from pregnancy or, sun exposure, whatever. But now I think you guys will agree with me, society has changed. What people focus on, these reality shows and doing selfies, it's created this whole thing of, these people want stuff that they never had before, and they want it for the wrong reasons. They want to look like somebody else, and it's very frustrating for me, dealing with some of these people where they, I get 25-year-old girls coming in thinking they need a facelift. I'm like, what are you talking about? Maybe just Botox and fillers. I go, no, you go home. Quit staying out all night partying and take care of yourself, and you'll be fine. But, it's gratifying to me to be able to take care of people that are, wanting just to improve a little bit, something that, has fallen apart. And I love to see them when they come back. But I hate to see these girls, coming in thinking they need this stuff. And unfortunately, it's bled into guys, the metrosexual, is
calf implants.
Well in plastic surgery.
Right.
But before I forget, because you made that comment about that TV show, there is some truth to that in the sense that, I don't know if you ever watched the show, but early on in the series, the guy's son tried to circumcise himself.
And
didn't succeed. Had a problem. And I actually,
botched.
3 days after that show, had a guy in Vegas who did the same thing. I had to take him to surgery, and he skinned himself, actually. He made the first cut, and his penis retracted into his pelvis, so the skin sheared off like you're taking off a glove.
Oh.
So he shows up at the emergency room. The girls are freaked out. They call a urologist. He doesn't know what to do. So they called me, and so we had to pull the skin, put him to sleep, put the skin back, and then finish the circumcision. So it's hilarious because I said, dude, what made you think of this?
Yeah, I guess the take-home message is don't try to cut your dick.
Look, man, there's certain areas that knives are restricted, okay, on the body.
Plus, they've been drinking tequila, so I said, branded tequila, because I don't want to ever drink that branded tequila. It's going to happen. Holy Christ.
I don't think this guy should ever drink again.
Yeah,
that's not a good idea.
If that's what you think is a good idea after a few
that is the perfect just say no campaign right there, man.
Yeah, it's
I've always wanted to get a circumcision. Maybe I'll do it myself. Save a few bucks. What could go wrong?
Bad stuff.
Yeah, there's some areas where you only get one shot, right? You don't get a do-over.
Reconstructing those is somewhat of a challenge. It can be done, but it's a challenge.
Come to think of it, your business partner or your partner at the facility, Dr. Pierce, he's kind of like Christian Troy, right? Maybe it was based after him.
Yeah, he's got a little bit more similarity. He goes out with more of those kind of girls than I do.
Yeah, that's what I was leaning for.
Yeah, right. Yeah, those girls in that alternate, environment.
You can't overhead press 200 pounds. You're not a fit for him. We won't go into more detail than that.
Those type of girls, okay.
That's another show.
We'll talk about that when we stop recording.
There you go. Good idea.
Now, what's interesting is there's a lot of new therapies coming out for people, let's say, who have stubborn fat, right? Like the whole cool sculpting.
Yeah.
And how exactly does that work?
What it does is a device that's got a vacuum is placed on your abdomen or your love handles, and then it sucks your skin into that. And then it freezes, it circulates cold water and cold, it's just below, it's that freezing actually a little bit below. Yeah. And actually the fat cells are frozen, and the ones that are closest to the head, so not all of them get treated at the same time, and those fat cells die just like frostbite. And the triglyceride comes out of the fat cell, and you absorb it over a period of 6 to 8 weeks. And then if you lose about 20 to 24% of the thickness of the fat level or layer at each session. So and then you can go back and do it again. They have some new ones that they don't have suction. They're not as dramatically effective because the cold isn't delivered as efficiently, but it does work. It's amazing. The desire to dissolve fat without diet and exercise.
People will go through stuff. What's funny is people will go through extremes that are way harder than working out hard and training, right? It's like I'm not going to eat for 3 months. I was like, man, you got some serious mental toughness. Because I thought running 15 sprints all out a couple times a week was hard, but I'd rather do that every day than skip eating for 3 months.
Or going 3 weeks just on a 500-calorie diet. Come on.
Some of these people think that liposuction, for example, is like a creepy crawly in your pool, that they can just go eat anything they want and then just come back and put the creepy crawly underneath your skin and just suck it out. I'm like, you have no idea. That fat's going to go, viscerally, and we're not going to be able to get it out.
Right.
And now you're skinny fat. And you look terrible.
Yeah.
But it's people nowadays.
Now, with the cool sculpting, is it more useful for someone who has leaned out and they just have a little bit of stubborn fat that they're trying to get rid of, or someone who is really overweight as well?
It's really not for someone who's overweight, because the chances of that skin really shrinking down is poor.
Yeah.
And if you're that big, these heads are only a certain size, so you'll start running into huge amounts of money. So it is just like liposuction. The ideal candidate is near ideal body weight, small little localized area, and those people do well. It's usually one session, maybe two, and they're back. And the beauty of it is the fat's gone forever. They're after puberty, so all you can do is change the size of the fat cells. And once you kill them, there's just less fat cells. That's why it's so damaging if you're a fat little kid like I was.
Yeah.
You get more fat cells when you're young, so you got to starve your fat cells harder than a person who wasn't fat because I've got more fat cells than the skinny guy does.
Yeah.
Right.
It's a bigger struggle for me to stay where I am. But
that's an important point, because once fat cells are created, they don't go away, right? So when you lose weight, when someone who's overweight loses a bunch of weight, the fat cells are still there and they can balloon out at any point, which is why it's so easy for people to gain weight back. Right. So if something like this actually annihilates them, that's pretty powerful stuff.
Yeah, and on the other end of the spectrum, you'll have these women that come in and they want fat injections to their lips, and then now if it survives and they gain weight, guess what? That fat behaves like the area that they gain fat in. So if they took it from their stomach to put it into their lips and they gain 10 or 15 pounds, their belly gets bigger, their lips are going to get bigger too. I mean, they're freaks. I'm telling you, they look like. Well,
no, that's freaky. Yeah, that one.
Yeah,
does that one ever look good? Because maybe when it does look good, you don't know, right? That's a job that's done well. Because the women I see have gotten that. You know they got it.
Yeah, it's like there's no doubt about it. I'm like, no, you weren't born with that, sister. I'm sorry.
Exactly. They just don't know. They don't know where to stop, because they look good and then they do something and then they get a little bit more attention, and then a few weeks go by and the guys aren't paying as much attention to them anymore, so they got to go do something else and something else and something else.
Get over the top, and then what you see in the mirror you get used to. So now when you first get, you're like, wow, it looks great, and then after a while you get used to it. You're like, maybe just a little bit more.
Yeah.
And I'll look better.
Exactly.
And
that happens.
And by then you've forgotten the original, so you don't even know what you used to look like anymore. So you don't have anything to base that on anymore. So crazy.
There's a lot of weird stuff out there now, especially Vegas, where you see Asian. There's like that Asian girl's got an ass like a black woman.
I know, exactly.
And I know she wasn't bored with it.
And she's got lips like a black woman. I'm like, I'm so confused right now.
Rack like a black woman.
But then there's a black woman with hair like the white woman, and she's got lips like a white woman. She's got a nose. I'm so confused. What is going on? I'm in Bizarro land right now. What the hell?
The Asian one is really funny to me, because I didn't grow up seeing stuff like that. That's for sure.
It's funny. It's like that song by Iggy, or not Iggy, but the one that says "All About the Bass."
Oh yeah.
It's these girls are so disproportionate. It's kind of funny sometimes. They're like Jessica Rabbit from that movie.
Right.
Like
there's got to be examples of people who got some plastic surgery, right? They modified a few things, and it really did improve the quality of their life. They just felt way more confident.
Without a doubt. I mean, years of doing this, you see girls go from being little, wallflowers to very confident women and going into business and stuff like that. Right. And that's the rewarding part, where you see someone who's, kind of hampered emotionally. And the funny thing is, I'm not a believer in Scientology. I think it's a joke. But the guy that L. Ron Hubbard stole that idea from is a guy named Maxwell Maltz, who was a plastic surgeon. And he started with this, envisioning things like for athletes. And he wrote the book in 1957, and L. Ron Hubbard just took it and bastardized it. But it's about, visualizing. You guys know. You guys are trainers. You guys are great athletes. You visualize what you want to be, and that's how you get there. If you don't plan it, you don't get your programming right, you don't do it, you're never going to get there.
Right.
And that's the same thing that happens with plastic surgery. I have people come in with these atrocious injuries, and they're absolutely normal emotionally. Yeah. And I have these other girls come in with one pimple, and they're devastated. They don't go out of the house, and I'm like, holy crap! What is this stuff? It's insane. It's insane.
Yeah. I've heard that kind of stuff from people. Like with vitiligo, right? Like I don't have vitiligo, but I have the appearance of it because I have this coal burn on my face, which looks similar. So if you didn't know better, you would assume it's vitiligo. So anyway, I'll have people with vitiligo email me, both men and women, who have very low confidence as a result of this. It started small, and then it started proliferating all over their body, and now they can't. Especially women, they have a hard time leaving the home. Their confidence is really low.
Sure.
So I mean, in a situation like that. Well, I guess there's two ways to look at it. I mean, at one point, you can basically just accept it the way it is, and then you just live with it, right? And that's some category of people will be able to do that. I fall into that category, for example. Others, it's not going to work, right? They can play mind games with themselves all day long, but inside, they don't feel confident at all. So unless they do some kind of procedure that's going to give them some comfort, some confidence,
right?
They could read all the self-help books in the world. They could take all the counseling sessions. It's not going to change their reality.
No, it's all based within inside of them, how strong they are, know, and how motivated and how committed, and I'm afraid that unfortunately we have a nation full of people that are not willing to commit to achieve what they want. They're weak emotionally, and it shows in how they behave, the decisions they make. It's sad.
Exactly, and they really think that money can buy that happiness. They'd rather spend $30,000 on procedure. And then another procedure and another procedure was like, you could have saved that money and actually just put in the work and actually enjoyed that journey, because you got to deal with the anxiety of going to let's just face it, a lot of times they're getting butchered up, and a lot of it's irreversible. A lot of things they're doing is like, you can't go back. Like little Kim, like God, she was such a beautiful girle, and like when she first came out, with Notorious B.I.G. Now she looks like the cat lady. It's like, what? So I always wonder, just from a psychological standpoint, like what happened to her mentally, what was said to her at a young age or whatever that made her think that she was not beautiful when she was clearly gorgeous, and
it's
she just kept
industry,
going.
Right?
Oh, well,
where people there are going, oh, you need to do this, you're getting older now, you need to fix this, and then.
Well, she started that when she was young. She did it when she was young. She wasn't even older. I mean, Kim is she's younger than both you and I, so she's not even that old, dude. And this started probably right after the Notorious B.I.G. was murdered. So that may have played a big part into it, because, she was very attached to that guy. So maybe he was very good with this, because he was very confident. I mean, this is a dude that even rapped about being black and ugly as ever. However, I mean, he married Faith Evans, and Faith Evans is gorgeous. So that said a lot. So that's one thing about guys. So many guys have nothing to lose. It's like they don't care. And I always feel bad when a lot of women tend to go and get all these procedures trying to impress guys. And like, we're not that complicated. It's just like, I'm pretty sure for most guys, if they're straight, if you have a vagina and it works, that's all we need. You don't have to go and do all this other stuff, man. Just like, don't give us that much freaking credit.
And for a lot of guys, you don't even need that.
Exactly.
You can just look like a woman without a vagina.
Exactly.
And we have some of those in Las Vegas.
Oh,
yeah. How many of that? What percentage of your client base is that demographic?
Well, it comes and goes in spurts, believe it or not.
Literally.
One going one way, one going the other way. It's a really challenging surgery, because you.
Oh wow, I bet.
But these people, once you get them through, in general, not all of them, but in general, I'd say 85-90% are extremely grateful and happy, because they get to where they're going to go. Some have problems, and I've had some that didn't make it and got addicted to drugs and that stuff. But
what do you make of someone like Caitlyn Jenner?
Caitlyn Jenner, yeah.
It's funny, because I understand being caught and wanting to be something else. I don't know. He's saying now that he was thinking about this when he was a teenager. I don't know. I mean, because here's a guy that performed at such a high level as an athlete and was a role model, was on a box of Wheaties and stuff. So I'm not sure when it snapped.
No, I have a different theory. My theory is that he spent so much time
with those
around
women.
All of those estrogen dominant Kardashians that he started morphing into a woman.
I mean, well, because here's the thing. Pretty much you're surrounded for about 30 years with people who are not happy with the way they look and who they are, and they're constantly changing who they are, despite being. It's like there's nothing wrong with you. You're gorgeous. You're talented. Some of them, So when it's to the point where out of all of them, only one is still the original, and that's Kendall, the one that's the model of all things. She's in the one industry where pretty much everyone's wanting to change themselves. She's the only one that still pretty much is herself. Her sister, you can't recognize her anymore because she's slowly trying to become a black woman now. It's just so crazy. And she started a teenager. This started just a few years ago. I mean, she just turned 18. So it's like, it's so crazy. So I think all of that started to bleed into when you're surrounded around. I mean, your environment really does play a big part in your thinking, in my opinion. Sure. Without you even thinking about it. It's just like, oh, well, maybe I need to change something about myself. Maybe I don't look good. Maybe I'm not the superior athlete that I thought I was. Or I'm not that guy anymore. And It just starts to play upon you.
I think Bruce Jenner just got tired of being the odd man out. He's like, I want to be part of the club.
Since none of the son-in-laws helped out. Every time we got a son-in-law around, they got weak as well. Just like
him, right? He's an athlete. He knows that.
He's looking at like his son-in-laws. They're all athletes, and they're bowing down like, wait a minute, Lamar, okay, he's pretty much okay. And there's Scott, who's just, it doesn't help. So it's basically every time you got men around the house, it didn't help him out to bring any more testosterone around there. It's like,
didn't have that role model anymore.
You have to wonder how much of these problems are first world problems, right?
Oh, there are a lot.
Because how many people in Rwanda are going, man, I wish I was born a woman, or I wish I was born a man.
Right.
Because they're on such, they're in such a desperate life where your worries are your meals, your family safety.
Just living tomorrow, just hoping your house doesn't get bombed. So
when you're too secure, your mind can wander to useless things.
That's where I'm going. You start creating
idle
problems that don't exist.
Exactly.
Right.
No, they do. Absolutely, without a doubt. Yeah.
It seems that it's people always think more is the answer. So it's like, man, I make $500,000 a year. It's not enough. I'll be happier when I make $1 million. It's like, well, that's not enough. I'll be happier when I make $10 million. So even with working out, it's like, yeah, I deadlifted 500 pounds. That's not enough, though. I need to deadlift 600. Then I'll be happy. Yeah. Then you hit that, you're like, well, I think I'll be happier if I hit 700. And it's just never enough. So, I appreciate going after goals and improving yourself. We all want to do that. I definitely want to do that.
Yeah.
But if you can't be happy where you're at right now, you're not going to be happy with the accomplishment either.
Right. And that's the whole thing. And, guys like you and I and Sincere, we use, athletics and working out to help us in a way to give us, we put goals in front, we achieve those goals, and that carries over to my business,
right,
to my life. I am what I am because of what what that gymnasium has taught me, to persevere and to not get upset when I fail. And people, that's why when you go to Las Vegas Athletic Club or 24-Hour Fitness, we hate it there because they're posers.
Literally.
Yeah, those guys don't want to work out. It's kind of like that old movie with John Travolta and where he was in spandex. He was the writer. 10, I think it was 10 or something. Not 10. It was it was set in L.A. and he's writing an article about the health clubs and fitness things are replacing the bars and nightclubs and stuff.
Man,
it's an old movie.
Yeah, it was like 82 or something like that when it came out.
But that's what these people use a gymnasium for. It's that, and then if you have a personal trainer, then you must be something special because the guy can count to 10. Those guys can count to 10. It's just ridiculous. They don't look at their client. They're on their cell phone texting. Right. And the clients there paying them, $100 an hour for what? I'm like, wow.
I rarely ever see a trainer in any gym correcting any exercise technique. Like, okay, go do this.
No.
And then they're just watching it. Even whether the form's atrocious or not, they're just watching it or counting the reps. They're not stopping, pulling it back. I'm not saying all trainers are in this category. I'm just saying my experience is I rarely see a trainer in a commercial gym actually correcting the client.
Use this. Good job.
To be fair to the trainer, though, a lot of times when you have a client and their technique is horrible, so you're spending the whole session just doing really basic mobility moves and so forth, and now the client leaves disappointed, going, I didn't get a workout. It's like, well, you're not ready to work out yet.
Yeah.
It's not safe for you to work out yet. You can barely touch your toes, let alone squat any weight.
Or the girl doesn't want to do that exercise because she doesn't want to, get bigger muscles. It's hilarious.
I don't want to get bulky.
I don't want to get bulky. Honey, you're already bulky.
Can we just do cardio?
I don't understand why a lot of women don't think that having some muscle is a good look. I'm not talking about bodybuilder muscle, but someone like Holly Holm, right? She's fighting Ronda Rousey. I think she looks great.
She looks great.
Yeah, physique is nice. Kat Zingano, great physique. They look very feminine still.
But that still goes back.
A nice look of power.
Yeah, but that goes back to the trainer again, not being knowledgeable, explaining to her that, okay, having muscle and being built like a bodybuilder are two different things here. So when they hear muscle, the first thing they think about is like China from the WWE. And they think like, I don't want to look like that. And those guys are like, okay, well, I can help you with that. I can help you tone up. So they dumb it down and call it toning, instead of saying building muscle. So, and that's the problem right there. But a lot of times he's trying
my attitude is if I have to explain it to you, you're with the wrong person, man. My philosophy was always, I'm going to build my business like this. So it's very in your face, like, you know what you're going to get. So that I don't attract people like that where I have to explain, something so nascent.
I'm just real simple. I'm like, okay, do you want to be skinny fat? And no, that's like a phenomenon. Like, what's that? I said, oh, the supermodel who has like 40% body fat, even though she only weighs 95 pounds. and that just throws them off because the industry and the media and all that, they never talk about that. They never talk about those things because they don't even understand those things. I'm like, yeah, I said, that person's very unhealthy. She's considered obese, believe it or not. And it just throws them off because in their mind, obese is supposed to be someone that's like 400 pounds. They have to have the walls cut down to get them out of the house or something like that on an Oprah special or something like that. And they think like, well, I'm not that chick. I'm like, yeah, you got about as much body fat as that chick though. So
well, I really think the most important thing is to have performance-based goals, right?
Right.
Like a strength goal or a fitness goal, something tangible. Because that's going to keep you on the right path in a healthy manner, rather than this narcissistic approach of just always looking at modifying your body.
Yeah, and how you going to look because it's gonna go away.
Yeah, exactly. Someone like Holly Holmes, she doesn't look that way because she's necessarily trying to. She's not like, well, let me get more ripped abs because that'll help me win fights. It's a side effect of training hard in a productive manner.
Right.
So I mean, when you train, like athletes are not necessarily trying to look away. That's just the side effect of their training.
Right.
And I think that's something the general population should take as well. It's like when guys are coming to me like, oh, I want to make my shoulders bigger, I want to do this. I was like, come on, man, grow a fucking pair. Like, give me a real goal. Like, you want to overhead press 250 pounds, you want to deadlift 600 pounds, you want to squat 400 pounds. Give me something that's tangible here, because the rest will fall into place. You eat clean, you're going to have better performance. So if you're chasing performance, you're automatically going to start eating better because it affects performance.
That's right.
Dramatically. I started cleaning up my nutrition when I wanted to get stronger because I realized what it affected. And
a lot of times it's really involuntary. Like there's something that goes on psychologically. Like you just won't even desire to eat that crap anymore. Because then you really start to feel it immediately when you do eat something crappy. When you really your performance is going up. You're like, God. You sit there and have those chips, and you're just like, God, I just want to go to sleep. But I just had a little bag of chips. What the hell? So.
And you're bloated the next day.
Yeah, exactly. Walk around like a marsupial. Just like, what the hell, man? Like, why do I look pregnant today? Where'd my six packs go?
That's true. The hard training makes you crave healthier foods.
Right.
Whether it's conscious or unconscious. I go run 15 all-out sprints. I don't want cake after that, or ice cream or something like that. I want real fuel.
And I won't sleep. I don't want to stay up to 4 o'clock in the morning after a sprint session. I just want to go to bed tonight, man.
And that food will teach you, because if you eat crappy the night before and you go to the gym, you're not going to perform.
No.
And all of a sudden you had this goal, and all of a sudden you didn't progress, or you took a step back, and you go, and that's where I find that reinforces my good eating habits. I get to the gym, I go, wow, I cheated a little bit last night. I didn't do as well. I wasn't focused. My timing was out of sync, and I go, well, okay, that's what happened. I ate this stuff. I go, okay, well, you got to start eliminating it a little bit more, or pay the price that the next day, don't push it too hard, because you're not going to.
I'm just thinking of what Mark Philippi would say. I remember Mark said, what the secret is to strength guys? Everyone's all huddled around. He goes, eating lots of ice cream. And he was being serious because all the calories and the fat and all that.
There's something to that.
It's like, I think we can find better sources of good fats and so forth.
He's truly old school, that guy.
Yeah. He is cool. But he always used to tell me, it's like, hey, you want to get stronger, it's time to put the feedback on. And to a large extent, he's right, especially with overhead pressing. I always find that the more weight I gain, it's like, you get an automatic increase in pressing. You're like, whoa, everything feels light now. And then you get on the scale, you're like, okay, that's why. You're 10 pounds heavier.
So everything feels light until you do that sprint session. And then you're like, wait a minute. Exactly. So then you got to ask yourself, what's more important right now? My 10 rounds of 100-yard sprints, or pressing 250 pounds overhead?
Doesn't help pull-ups either.
Oh, hell no.
But with the sprints, you're running like Optimus Prime now. before I was running like a gazelle. No,
oh man,
I look like Megatron running down the street. Feet are all flying.
There's a reason why eventually after they run, they eventually turn into an airplane and just fly off. They're like, you know what, F this. I can fly, damn it. Why the hell am I running?
Why are they running? They can turn into a car.
Transformers right there.
But yeah, man.
Now, what's also interesting is you do some stuff with stem cells as well, right?
Yeah.
And it's stem cells where you take, to put it in a really basic definition, you're just taking stem cells out of stored body fat.
Right.
And so, yeah, you get a twofold benefit. One, you lose some body fat, and then two, the stem cells can be a restorative. Can you get into how that works?
Sure. What we're trying to do is the stroma, or imagine that you got fat cells and you look at your floor and there's tile. Well, the fat cell is the tile, and where we're getting the cells from is actually the grout between the tiles. So just like in a muscle where you have satellite cells that that splinter off and grow and get bigger, it's the same thing in this little grouting between the fat cells. They contain mesenchymal cells, stem cells, and some cytokines, which are both pro and anti-inflammatory. We extract that from a fat. We don't use the fat. We throw it away. And then we take these cells. We don't change them in any way. We purify them, get all the blood product out of them. And then depending on the injury, like a lot of the pro athletes we inject it into a bad knee, a bad elbow. Some guys have, some muscle issues with sprained muscles. Hamstrings are always hard to come back from, and groin pulls. So we inject it directly into the injury. But we treat people with like lung disease too, with you can give them to them IV, and the cells then locate to their lungs, and their breathing improves. Many times they can decrease the amount of oxygen or go off the oxygen they're taking. So, but the thing is, you got to educate these people, because it's not like taking an antibiotic when you have an infection. What we're doing is, supercharging your ability to heal, but it's up to you to heal. And that's why it's not an immediate thing. It gradually gets better for 4 to 6 months. So the athletes, the pro athletes especially, they just heal faster. They can get back to playing faster, and that's where you see them, because they're already pretty healthy kind of guys. Mm-hmm. Although I'm always amazed how poorly pro athletes eat, even in season. It's amazing. Yeah. And then but
that's the downside of being genetically gifted.
Exactly. But we see what happens when they retire, how it catches up with them. Yeah. And he's like, whoa, what happened to him? You see someone like Michael Jordan is like, he looked like he's been working at a car dealership for the last 5 years or something.
Right. Yeah.
The worst was, what was that guy who played for the Phoenix Suns? Man?
Oh, Charles Barkley, man.
Yeah, Charles Barkley was the worst.
But you knew that was coming, though. You can kind of see that was going. You knew that was going to happen with him. There was not a secret with that. But you see someone like Shaq, it's kind of like, whoa, what happened?
What happened to him?
But whereas you got someone like Michael Strahan was just the opposite. He got smaller and looked a lot healthier now in his retirement.
Yeah.
Right. Yeah. It's a matter of what you want to do with your life.
Yeah.
You want to live a long time, you better take care of yourself.
Right.
Sure. You guys know that more than anyone.
That's the mistake I think a lot of people in their 20s have right there, is they're not thinking about consequences.
Yep.
Like I'll do whatever it takes to achieve this. And then you're basically crippled in your 40s. You have brain trauma, your body's shot.
Yeah.
And you're going to live for a while. So you're in that state, just completely unhealthy, depressed. Depression obviously follows from that. A lot of head trauma and depression are correlated strongly.
Right. Yeah.
And then just being in your early 40s and your body's so beat up like that, that's depressing too.
Or you take the guy that's at the local gymnasium, at a Lifetime Fitness or that who's taking anabolic steroids. He's never going to compete. He's not a pro athlete, and he's on gear.
Yeah.
And then he wonders when he's on it for 2 years that his testicles shrank and he feels like crap and he's depressed and well, dude, you did it to yourself.
And a lot of times they don't train properly either, which is the most frustrating part. So you're going to take gear, at least figure out how to work out.
Yeah, don't sit there and curl in a squat rack, and you're taking gear. Like, come on, dude. There's some people out there like, you're wasting some good stuff, man.
Yeah, you're taking gear and you're still not strong.
Yeah. Right.
Guys that have no legs, the fitness models, no legs. They got the board shorts on.
The martini glass is what I call them. They're built just like a martini glass. They're all big up top, and then you get to those legs. True, there it is.
They're like storks or flamingos.
Yeah, exactly.
What a travesty,
man.
Now, back to this whole stem cell thing. Can it also help with, let's say, joint issues? Let's say like I've got this joint issue on my left arm where I just don't have the fluid in between the joints in the elbow, so they're basically rubbing on each other quite a bit. With something like stem cells, allow restoration there where I could get more fluid in between.
As long as you have cartilage there, that will work. Now, temporarily, if it's just a fluid issue, most likely, your bursa there that creates the fluid is partially to blame. So, the fluid exists there, but you're constantly making fluid to lubricate your joints. That's why you see some orthopedic guys inject, substances in there which are, synthetically made to simulate that fluid, like Synvisc and things like that. Yeah. And it works for a few months. In your case, if you've got cartilage there, it'd probably be worth injecting. If you're bone on bone, it probably wouldn't, because it's not going to raise the dead. Yeah. But if it's just a fluid problem, Mike, I would say, go see. I'll give you a name of someone who can inject it. Maybe put some Synvisc short term. See if you can get some space reestablished, and then go from there. I do think that if you've got some cartilage issue that you've damaged and there's still cartilage there, the stem cell therapy will certainly allow you to heal. They've got some amazing thing that I know a guy, a PhD in Valhalla, New York, who's got it's like a matrix, like a mesh, where they're soaking it into stem cells, making a defect they're testing it on animals now. They're up to, I think, small dogs. So they have a defect, just like the way the orthopedic surgeon, when he clips your meniscus clean so you don't have that hangnail. Yeah. They can get a 3D printer to make the mesh the exact same size as the problem that you have in your knee. They then soak it in the stem cells, and then through a scope, they just put this in like a little Lego. Wow. It sticks there, and 6 months later, it's like you never had a problem.
Wow.
That's where this is going.
Yeah, that's amazing.
Yeah, I'm telling you, 5 years from now, it's going to be very different out there for a lot of people.
Are you familiar with nanotechnology at all?
Sure.
Have you updated on that? Mm-hmm. How far away do you think we are from that, where basically it's like injecting little robots into your bloodstream, which can turn off potential disease markers, which can heal certain areas?
Well, it's already we've been playing with this. Honestly, I did some research on a similar thing back when I was still in medical school. And what they're doing is, how they're manipulating the nanotechnology is down the road. It's coming. They're working on it. Now what they're doing is they will take and develop antibodies to say you're cancer. They'll do a biopsy, then they'll grow it in the lab. They'll develop antibodies that they can tag with chemotherapy or a drug, and then they inject it into you, and that little thing just goes and finds a cancer and delivers all the chemo just to the cancer instead of to the whole body. So it's a really targeted attack. And the nanos, they're coming. The whole thing is it's a device that doesn't last forever. You're going to put it into someone's body. So one of the concerns that the FDA is having is, well, how are we going to get rid of this stuff? What happens to it after it burns out? Yeah. It's like that movie Fantastic Voyage. How do you get the submarine out of the body? And but they're using nanotechnology now on skin things for creams, and they're using nanotechnology to deliver an effective narcotic like OxyContin in a much lower dose, and it's making more effective, so you don't have the trouble with your livers getting fried and all that stuff. So nano is gigantic. It's funny. It's just a little thing, but it's gigantic. Right. It didn't make any sense.
No, I mean, like performance enhancement's about to go astronomical in the years to come. People are looking at performance enhancement now and hormone optimization now, so we haven't seen anything yet.
So trust me, all your sci-fi movies are about to become reality, folks. Big time.
Right. I mean, performance is. I mean, it's no longer on the market. The company ran into some problems, but they had a cream that was dissolved into nanosomes, and actually it was like a little pellet, and you had this device you could push it into the little hole in your penis, and it delivered but it delivered a prostaglandin which made you get an erection. So once Viagra doesn't work, the only other options these guys have is actually take a 30 gauge needle with the patient, shoot it in it. Which, let me tell you, I I could never be able to do
that stuff, though, will make you hard as a rock whether you're aroused or not. So now you're walking around with a sledgehammer.
Exactly.
You know?
Like, coming through. Watch it, man. Excuse me.
And it's not going to just go down on its own.
No.
So there's some problems there.
You ejaculate and it's still there.
Yeah, exactly.
What am I going to do with this now?
Those warnings about a 4-hour erection, they don't really apply. I mean, it's laughable in the context of Viagra, Cialis, because I doubt it happens often there, if ever. But with those injections, it probably happens every time. You have to take something now to
calm that down.
To get the blood to dissipate from that area.
I'll give you a personal story. When Viagra first came out, a guy came by, gave me a sample, and I was like, I was going to use it recreationally because I wasn't having a problem. And I'll never use it again because I took one of the small tablets, a 50 milligram tablet, one time, and I'm trying to have sex, but my nasal passages got so swollen because they're the same kind of tissue. I couldn't freaking breathe, bro. So I'm down there doing the nasty, looking at her unit down there, and I can't breathe. I can't perform because I need to stop breathing through my mouth. I go, well, I can't use my mouth to do it.
It's hard to breathe down there as it is.
Exactly. It's like, wait a minute, man. My mouth is down there for one reason and one reason only. I don't need to be focusing on breathing while I'm doing it.
You don't need your nose clogging.
And I'm sure she doesn't want me to try to like huff and puff while I'm down there either. It's like, come on.
Exactly. She says, you okay? You okay?
It's like, you drying me out, bro.
Coming up for a gasp.
You know what's funny though is Viagra has been a lot of athletes are taking Viagra as a pre-workout supplement.
What?
I know.
It actually increases oxygen utilization and it improves endurance.
Yeah.
So now I think it's on lists for it's on banned lists now for a lot of athletics for that reason.
But how it works, you guys know it's through nitric oxide.
Yeah.
That's the stuff that the three of us all take before we train. That my pre-op or my pre-workout thing is very similar to yours, Mike, and I'm sure you're sincere.
Mm-hmm.
I actually get my stuff from a powder company, so everything comes in tubs,
right.
so I can mix and match. And and I like your suggestion of the day. I tried it yesterday. I threw a little nootropic in there, and wow, it was like, man, this is cool.
Even just the combination. You don't have to combine them in one drink. Coffee, strong cup of coffee, and beets.
Yeah.
Although maybe I'll make my own beet coffee.
I was about to say there's a future project for us to work on right there, Mike.
I'm sure someone's gonna rip that up. Like, let's make
beet coffee.
That combination works really well. Yeah. Doesn't taste good. I've tried it before, combining the two. But anyway, the combination does work well. You have a cup of coffee, and then you can just take a teaspoon of beet powder. You down it. Yeah. Hour later, you go work out. You get a serious pump. Pump. Endurance is incredible with that combination.
It's funny because the problem is that a lot of that NO explode out there and that they promote it. There's so little arginine and so little things that are going to actually promote it. They put it, minuscule amounts, and then they put a bunch of stimulants in there so you think that it's happening.
Yeah. But the real test of a pre-workout drink is, does it work without any stimulants?
Right.
No
No caffeine, no synephrine, none of that stuff.
Exactly.
And it's going to be subtle. It's not going to be something you necessarily feel until you work out, and then you go, hey, got more in the bank.
That's the important part, because these guys think that they should take it for the pump so that their muscles get swollen. Like, swollen muscles don't necessarily get any bigger. That's not what causes the muscles to get bigger, guys. It's kind of like these guys out there. I don't know. They just believe everything the guy at the health food store tells them.
Well, it's kind of like these erection pill advertisements. Yeah. Like, you're going to grow 6 more inches. Yeah, you're going to get erect like that. But then when it goes back down, you're a little man again. Okay, you're right back where you started, buddy. So that pump does not necessarily mean your reality. Okay.
Like, turtles back in the shell.
It's cold out there.
No, but with the pump doesn't necessarily lead to bigger muscles, but it's a cool feeling, right? Like when you're working out hard and you're lifting heavy weights and your arms are all pumped up, and then the way you feel, if you look better, most people are going to perform better. And that's what's the name of that coach you worked with, a football coach, Jay Schroeder. Yeah, he worked with Adam Archuleta, and he would have some of the guys do some bicep work because he found that if guys' arms were bigger, they felt better about how they looked and they automatically performed better.
Yeah, I can see that.
Well, I mean, listen, we've seen that at the gym on Fridays. Guys doing bicep curls because they're going out to the clubs that night.
Exactly. I mean, let's just take it back. Let's take it back to high school. Let's just be honest. Back in high school, before you go out or you about to go on a date, you did like about 50 push-ups right before the girl gets over there. So your chest is all tight and your arms all pumped up. You wear a shirt that's a size medium, just to prove.
All guilty.
Some guys we know. One guy in particular, a well-known kettlebell instructor, he still does that.
Are you talking about Ken again?
Yeah, of course I'm talking about Ken. He wears shirts that are about 3 sizes. He wears a shirt that I would wear. Okay, and he's about 30 pounds bigger than I am.
Come on, you got to stop shopping in the boys section at Marshalls, man. Come on.
He's putting on his son's shirts. It's like, hey man, let me borrow that shirt.
Pretty soon, that's not going to work anymore.
No. Oh man.
That's too funny.
Oh, man.
Yeah, so it makes it. But at the same time, what's funny is that doing all the curls and all that, you're going to get better results doing, like Sincere said on a previous episode, do some weighted dips. Your arms are more triceps than biceps, right? That's going to blow up your arms. Do some weighted dips, do some weighted pull-ups. You don't need to do anything else.
Exactly.
I agree with you. But
chin-ups and dips all day, man. I mean,
the old Charles Atlas thing.
Yep.
Right.
Oh my gosh, for sure.
But Dr. Garcia, here's this one thing about there's always this big hang up about stem cells. You always have it becomes this political issue and everything else. So many people have an opinion about it but don't even know what the hell they are. So I mean, what exactly are the stem cells that you utilize in your practice, and what are they not? Let me just put it like that.
It's a good question, and luckily and I'll explain the whole thing so it'll make sense that way. We are using our adult autologous stem cells. So it's from the patient. It's only used on that same patient. And they're only harvested from actually cells that they already have in their mature bodies. For years, everyone thought that embryonic stem cells were going to be superior because they were, quote unquote, just baby cells that hadn't changed into anything. And over the years, we found out that we have stem cells all over our body. I mean, your testicles are full of stem cells. You're making, sperm all the time until you're, 50 or 60. And the same thing with your blood cells. That's why bone marrow was one of the first actual stem cell things that you got. You had to donate it. So luckily for the conflict, there's never been a proven benefit to embryonic stem cells, which are harvested from aborted fetuses. It's never been shown to be superior or even equal to adult stem cells. So what we're using is actually the patient's own material, and we give it to them back. We give it back to them. They have it back in their body within 2.5 hours. That's how little time it takes us to process and clean it. But these cells have the same regenerative process and properties that the embryonic ones claim to have. These are cells that have not differentiated into anything. They can, now you can put them into a lab if you want and have them differentiate into cartilage or nerve or muscle or whatever. But we're giving them these pure things, and they behave when you inject them into the body. They have like little GPS units on them because they go find what's broken and they stick to it, and then they try to heal it. So that's where I feel very comfortable. There's no ethical issues with our product. And I think even the 16 companies that are doing big time research on stem cells and developing them, very few of them are actually using embryonic cells. They have a donor, usually an 18 to 22-year-old person who's been deemed healthy with all this exams, and then they harvest cells from them and they grow them in a lab. So adult stem cells are really where it's all going to come from. There'll just be a few producers that'll make it, and then we'll be able to buy it off a shelf and mix it up and inject it to whoever needs it. It's going to be awesome. Yeah,
because of that moral dilemma, which is not even relevant,
right,
to just what you just said, we lost years of wasted time that could have gone to research and move this whole thing ahead during the whole Bush administration.
Oh yeah, when you start politicizing it, it's a wrap, man.
Yeah. I mean, some research continued. The federal funding dried up, and that's where, good or bad, a lot of private money moved into developing stem cells. And, private money, just like it does in the food industry, and I know how you guys feel. I mean, it can create problems.
Yeah.
When private money gets to be too big in a certain industry, it's a problem.
Yeah.
Right now there's 16 companies worldwide doing stem cells. They've invested $60 billion, and there isn't a single drug on the market yet. So they're spending a lot of money, and it's going to pop. It's just a matter of time. The public's screaming for it. The doctors hate it because a lot of what they do is going to go away, which it should go away. 'Cause they're practicing shit that's voodoo. I mean,
Right.
Jesus
Yeah.
Christ, I mean, it's terrible.
Yeah. A lot of Western medicine is in the dark ages.
Yeah, I mean, why do you go to medical school and don't get nutrition classes? That's absurd. It's absolutely absurd. I had to teach myself all this stuff afterwards.
Right.
I mean, I remember when I was getting into anti-aging and doing hormone replacement, I was studying and looking for stuff back in '92 when I was starting to get interested in this stuff. And I went to the A4M, and back then the A4M was kind of a weird thing.
Yeah.
But finding articles
Still
on the
is.
internet it still is.
Yeah.
It was hard. I mean, now you got Google. There was no Google in '92.
Right.
I was in the library. It was, and now we have so many more advantages, and I think that's where the advances come from. People want it, and companies will say, if these people want it, I'm going to build it, and that's where we're going. So it's awesome.
I mean, the most precise nutrition information does come from the bodybuilding community because they have it dialed down to an exact science.
Yeah,
water levels, everything. Whether you like it or not, that's just where no one is looking at food more closely than that demographic.
Yeah.
So it's worth spending some time looking at what they're doing. You don't have to go to the extreme levels they do.
No, exactly.
But it'll give you a much broader understanding on how to dial it into what you want to do.
True. No, I can't agree. I can't agree with you more. They are very educated, and you just got to take that little pearl that they have and move with it and move on to the next thing. You don't want to live their lifestyle. I have close friends that are pro bodybuilders that have been for years, and they have a tough life coming off that stuff. When they start shrinking emotionally, they get bothered and their joints are beat up, and it's a tough sport. Very tough sport,
Yeah, and there's some body image issues there as well. I remember there was this one guy, very famous guy during the 90s. He passed away at a very young age. I forget exactly I want to say it was suicide, but I'm not 100% correct on that. But anyway, this guy was huge, probably 23-inch arms, and he always wore long-sleeve shirts because he felt his arms were too small.
Wow.
It was just amazing.
Well, I will say, I think people that compete and train to be bodybuilders, there is some element of body dysmorphia. Just like
no doubt.
Oh yeah.
These guys never think they're big enough, and that's why I've never, done it that way, because there's always going to be some guy bigger.
Right.
It doesn't matter. I mean, it's now I lift now for go, no show. And it goes for me. It's just my goals. I don't tell anyone my goals. Philippi, and that's about it. It's my goals, and they're driving me. They don't drive anybody else. So
yeah. Plus, at that gym, you'll be made fun of if you talk about trying to change your body in any way. You're going to be ridiculed.
That's brutal, boy. I'm telling you, it's like being in Marine boot camp, and when you're in there, people screaming and yelling at each other and calling them names.
Someone comes up to Mark, I want to make my arms bigger. Why? If you don't have a good enough reason, you'll be walking out the door. You're not even allowed to wear tank tops in there. It has to be shirts.
He runs a very tight ship, no doubt. No doubt. Yeah.
It's a fun place to work out, though, PSI in Vegas.
It is.
Because everyone is in there. My experience there, I trained there for about 4 months. Whether it was a teenager working out or whether it was someone in his 50s working out, everyone was in there pushing it hard.
Yeah.
It just had that kind of energy in the air. So you automatically stepped up your game.
For sure. And everyone there, like, they'll be walking by you, and you're getting ready to do a heavy lift, and they're screaming on you. You got that deadlift halfway up. They go, come on. It's a team. It's that brotherly love, that gets you through so much.
No, it's really true. Sometimes you would walk in there just not ready to push it. And then I remember one time I walked in, I was just having an off morning. And this young girl was just doing pull-ups, and she banged out 12 perfect. And I was like, well, shit. I'm not going to wuss out now after seeing that. Like the little girl volleyball teams in here, I'm not going to be the guy. So sometimes you're competing with yourself, but you can use
sometimes your ego comes in handy. Yeah.
Like you're not literally competing with them, but you can make that in your head to bring out a better performance in yourself.
Yeah, it's basically what's your excuse? And it helps.
You got to see it in your gyms all the time, Sincere, right? I mean,
I see
that vibe going, and all of a sudden the guys are hitting PRs, and they're It's weird at Philippines because you're not allowed to swear. You can't have rap music on the radio.
He's the anti my gym. It's just the opposite. Right. My gym is like, cursing, but that's the only way we can express ourselves. It's like, you gotta let it out, man, because I'm trying to keep you from becoming a potential, mass murderer. Don't hold all that stuff in. Let it out.
Well, people sound like they have Tourette's. That's
when he's out of town and we're working out, we go out to the car. I get my iPod, we put on, NWA, and we just rock it. It's hilarious. Everyone's like, "Oh, coaches must be out of town. Christina's got the iPod in
here." Yeah, man. But yeah, it really helps because lots of our girls are. I mean, like I said, the girls that train with us are gangsters. And I look at the dudes, I'm like, really? And I was like, look at her. She's not bitching and complaining. Like, come on, man. She's lifting what you're lifting right now. You having a problem with that? I was like, well, she's stronger than me. I said, oh, and you're okay with that? You sound like you've made peace with that now. It's like you don't want to strive to be stronger.
It's funny how some of the biggest whiners are guys.
Man. It drives me crazy.
Yeah. More often than not, it's some guy whining.
Yeah, it is.
Some lady whining.
And I'll call her and say, "Come on, mama's boy, let's go."
And I'll tell you, some of my best training partners have been females.
Oh yeah.
They push. I mean, because when they say, "Come on, pussy."
Yeah.
Like, oh shit.
Because in your mind you're like, I ain't no pussy, I ain't no punk.
Just use that word against me. I'm like, all right,
For some reason, when they say it, it just makes it even more valid. When another guy says it's like a joke, but when a female tells you, it's like, wait a minute, you meant that, didn't you?
Man.
Tell me how you really feel.
Yeah, well, yeah, it's
it helps, man. It helps.
It does. That's the beauty of that.
See, that's a real training environment, right? Compared to the workout environment, like you see at a lot of commercial gyms.
I forget who said it. Maybe one of you guys did in one of your earlier podcasts, but we don't work out; we train.
Exactly.
There's a difference.
Yeah. Said that. Yep.
Yeah. Yep. There's such a big difference. It's not the same thing. If you want to work out, go to that gym with the chrome plates and the purple and the yellow. What is it, Planet Fitness or whatever?
Oh, just do like the commercial. Just press play. Like your P90X DVD. Just press play.
That kind of goes back to my earlier point that you should be training for a performance goal because that keeps your workouts focused, your training focused, rather than a lot of people just show up at the gym and they just do random stuff. They just show up without any plan whatsoever. Like a couple curls here, some rows here, a little leg press there. No cohesive plan. They have no idea what they're trying to achieve or where they're going. They're just showing up. And that old saying, showing up
is half the battle. Yeah.
Bullshit. Showing up ain't jack shit. You don't get fucking dick for showing up. That's what you actually do when you show up.
Exactly. It's so funny to hear that showing up is, that's half the battle. I said, ask a soldier that the next time he has to be deployed. I just showed up to Iraq. Hey, that was good enough. Like, no, he shot back. He's shooting at me, dude. Okay, I need to do more than just show up. Okay.
That's probably the attitude all of Ronda Rousey's opponents have. Exactly. It didn't work. It didn't help.
Well, that was my high school philosophy when I used to watch Mike Tyson fight. You know what? For $20 million just to show up and get knocked out, I'll do it for $20 million. So doesn't mean that you're going to be great.
Mike's an interesting dude. I worked out with him a long time ago, and I've taken care of him a couple of times. I actually, my only true claim to fame was I'm on the 90s version of Trivial Pursuit because I'm the guy that sewed Holyfield up after Tyson bit him.
Oh, wow.
And the weird thing is, I've known Mike since he moved to Vegas many years ago. I used to work out with him at the gym, and back when he hadn't won the championship. And used to come into my office when he'd get banged up and get cut, and we'd have to take the picture because I had a picture of Holyfield and him and Holyfield getting bit. I had it on my wall, and what's his name? Holyfield's consent was signed on there. Mm-hmm. And when he would come over, I'd have to take it down so he wouldn't get mad. It was so funny. He's changed. You guys know him. He's a different person.
Yeah.
He lives around the corner from me and Mark Philippi. We both all three of us live in Seven Hills, and Mike's around the corner. I saw him at the airport one time. We saw his stand-up show not too long ago, which I thought was fantastic.
Yeah.
No, I did too.
Really good speaker. Really cohesive, coherent.
He just flows.
Yeah. No ums, none of that. Just bam. He's not reading something either. And there's
No, it's
screen
top of
in
the
front him
head,
he's
man.
reading off of. Yeah, exactly. He's a very good storyteller.
Yeah, he's got stories.
Oh yeah.
He's got stories.
Yeah, man.
That's for sure. Well, what was it like training with him? Was it weight training that you did, or you?
Yeah, he
just
was
sparring?
working at a gym that's now a strip club. But
Oh yeah, what's
Really?
Hewitt Sapphires.
That used to be a gym. That place is huge.
Wow.
That makes sense.
Oh, dude, that gym was awesome. And he had just gotten in there, and he was just going in there, working out one day. He needed a spot, so I spotted him and stuff. And we worked out maybe once or twice a month together because his schedule was different than mine. But on Sundays, if we were there, we train. And he's a beast. I mean, he's the kind of guy that once he gets going, man, that's why I love training with him those handful of times, because he's a trainer. You just got to run after him because he's going.
Oh, yeah, his work ethic is unparalleled, man. Just reading his autobiography, I was just like, wow, man.
Yeah.
He's an amazing guy. Really,
the first time he ever tried bench pressing, he did 250.
Yeah, I mean,
I think he was 13 or something like that too.
Never done it before. How can you do that?
Yeah, exactly.
Right.
Crazy, Dad.
Where are you
crazy?
I mean, growing up where he did,
right?
I'm sure he wasn't eting well. Imagine if that kid had eaten well.
Yeah.
What would he be like? Holy Christ! But that happens. You get caught up. He got caught up with the Don King thing, and
right.
It was tragic. But
everything was just downhill after Custom Model died, man. He was left to the wolves after that, man, because his protector was gone.
Exactly, and we all need one of those.
Well, that's where I feel bad for a lot of fighters in the sense that they don't have that, so they are put through this meat grinder of a career.
Right.
And then when it's over, they have all kinds of traumas and really no viable way to make a good income.
Right.
So I think, especially the UFC fighters who don't make that much to begin with. Even the top tier guys do well, but looking at boxing compared to UFC, it's night and day. But the average guy, forget it.
Oh, I don't know.
Barely making enough while your career is at its peak.
Yeah, and they're always hurt.
Yeah.
And and listen, I love the Fertittas and I love Dana White, but the way they run it, they know that there's guys in line. If this guy goes down and gets hurt and can't fight anymore, hey, he's replaceable.
Very replaceable.
Everyone is replaceable.
And every athletic organization is the same, right?
Oh yeah, NFL. I mean, come on, yeah. I mean, you're just a product for most of these guys. You're a cash making machine. So, and you should accept this when you're getting into that. So, this is the reality. So the question is, what are you going to do about it? So don't bitch and complain about it like, okay, you've accepted this. You signed on for this. When you put your name on that dotted line, you accepted it. So you should accept that with a plan, with an out for yourself, where you're not just that one thing.
Well, what some have decided is that it's not worth the risk. Like that one young guy decided, forget it, I'm out. After he played for a year, he decided, I don't want it. I don't want the potential brain trauma.
Right. Yeah.
Yeah, it's that stuff like that. I mean, it's opening kids' ears and eyes to stuff, and sports is going to change. I mean, one thing about MMA, we bashed them a little bit there, but at the same time, it's better to fight MMA than boxing.
Oh, no doubt.
Oh, yeah.
Because you're not going to get the kind of brain trauma. Yeah, your career may be 2 years because you're going to have some broken joints and this and that, but you're not going to suffer that repetitive concussion that the boxers do. That's one good thing. I mean, I actually think they should make the gloves lighter.
Yeah.
Let these guys, get hurt so they stop the fight rather than.
I mean, in the good old days, it was bare knuckle, right? So most people, you wouldn't do a lot of striking because you'd break your fist.
Yeah, it's not gonna be a 12 round. It's not gonna be a 12 rounder when you're going bare knuckles. Because if it is that person who's getting beat, like, okay, that dude's got more than a great chin. He's got a hard freaking head, man. If he can last that long. Exactly. Like, have you ever watched a fight in the parking lot at the club? And after the club is over, can you imagine those guys trying to go for like an hour doing that? Hell no, they wouldn't make it.
Those are 30-second fights.
Exactly, if that.
And enough of them. It's like.
What about 100? It's about 100 swings, only 2 make contact, and it's over in 30 seconds.
You're getting a good workout in anyway.
Exactly. Who are you fighting? The mosquitoes or the guy? Like, God, who are you swinging at, man?
Yeah, we probably look more like girls fighting when you look at because you're not hitting shit. Right? You're just swinging out there like.
Yeah, it's more crap talking going than anything else, man. Like, hit me, I dare you. Hit me, I dare you.
Yeah. It's a lot of posturing, hoping that the bouncers will break.
Exactly. Like, come on, man. What's taking those bouncers so long to get outside?
That way you don't lose. You're all looking around. Come on, where are they?
They're walking around in circles like, damn, where's security? All right, man, what's up?
Yeah, I did a little security when I was in college. And we used to see a lot of the interrogations, right, where one guy would get in another guy's face and they're pointing with their finger, they're pushing, but no one wants to commit.
Nah, exactly.
It's a pushing contest. Kevin Hart made that joke about. He's like, I'm not a good fighter, but I'm a good pusher. Right? Exactly. So he's like, I can just keep pushing until the counter's gonna break it up.
And then once they commit, it just becomes, it becomes a marathon of the headlock. Like, how long can I hold you in this headlock before you give up?
Yeah, that's true.
Oh,
that's
man.
True,
Dudes.
Oh, man. Yeah, there's so much idiocy.
yeah. Oh, yeah. And in this town especially.
Yeah, that's what I mean. In this town.
Yeah.
The false bravado here is just like out of control. And then the way these guys spend money trying to throw it around like there's some big.
Oh my gosh, it's ridiculous.
Well, you see that at the blackjack table where someone who has it's always the worst player who does that too.
Of course.
They have no clue what they're doing, and they just keep putting a big stack of chips down. I'm like, man, this guy's an idiot. And the worst is when they win for a while, because then they think they actually know something.
Right.
They're like, see, I knew it. I just felt it. I was like, yeah.
I told you, watch out.
I was sitting next to a guy at the South Point, and he was just playing big stack every hand, and he won 5 in a row, even though it was a really crappy deck. There's no reason why he should have won, but he did, just dumb luck. And then I was like, this guy stays long enough, he's going to lose it all. And sure enough, that's exactly what happened. Because in his mind, he thought he was on a roll. He's like, I'm on a roll, man. It's like, yeah, I just felt it. It's like, all right, let's see how long you feel.
But see, Mike, you walk away. You know it's a game of streaks. This guy, he's not a good gambler because he doesn't know that yet.
Yeah, there's no instinct. There's no instinct that's effective in that game. It's all mathematics. It's all numbers, right? Yeah. So whatever your gut tells you doesn't fucking matter.
But you got to be like a lion on the Sahara desert. Because once you get enough to eat, walk away.
Right.
Stay there.
Exactly.
Stuff, you're going to get in trouble.
Damn good example. Yeah.
I had a good run at South Point too another night, and there was a bunch of older Asian ladies there that were like, "No, don't leave, right?" But they thought I was their good luck charm. And in some ways, I was, because they saw me doing well. They started increasing their bets, not because they knew what I was doing, just because they just thought, "Hey, this guy's on a roll." And then once I left, they thought it was about to go. They thought their luck was over, which in reality it was, because the hands were about to go south, right? But not for the reasons they thought. I was like, if you ladies are smart, you'll leave right now.
Come on, was those?
You can't say that.
Hey, Mike, was it the Asian ladies with the butts like black ladies and lips like black ladies?
I had more of a butt like a black woman. These ladies are looking at me going, I wish I had that much.
They could too.
It's my hey. Now we can reference them to someone now. Dr. Garcia can take care of them.
Butt injections. Go to the gym.
Well, what do you do though when you have a young woman who comes in who's like, look, I'm not happy with my ass, I'm not happy with my rack. I mean, what's the procedure or the counseling or the questioning that occurs in that situation?
Well, to be honest with you, the breasts are a little bit easier because there isn't much they can do to do that. Although women still go to the gym and work their pecs. I don't know for what reason.
Get rid of what little you have.
Right. I'll tell you, people come in for butt, augmentation.
Yeah.
The first thing I tell them, I said, I want 6 months of legit glute training. And I give them the name of people, articles to read about how to train your glutes. And they go, well, but I want a big butt. I go, well, that's what's going to give it to you. Because they come in with that flat butt. They didn't lose fat. Their glutes are atrophied.
Yeah.
Because they never use them. And I'll tell you, there is nothing sexier than a girl with a nice set of glutes.
Hey, man, someone said no one ever made a song about a flat ass, okay?
I don't want them floppy now. I like, they got...
Al Pacino didn't get excited in that scene in Heat over a flat ass.
She's got a great ass.
See that facial expression?
He said that with passion, man. That wasn't even in the script. That was...
Women need to realize that we're all making that face inside when we see a great ass.
Hey, man, you know an ass is great. You know an ass is great when an ass is great when a woman walks by and another woman goes, "Gosh, she's got a great ass." That's the compliment right there. Okay, that says a lot.
Hunter-gatherers, and that's what women don't understand. We're drawn to things visually. But at the same time, that girl's going to move out of our view. We forget them. We're just like animals.
Because there's going to be another ass walking by. Like, whoop, there's another one.
Exactly. I noticed that.
On to the next one.
Which goes back to what I said. Women, don't try so hard. Don't give us that much credit. Okay, it doesn't take that much. See, that goes beyond the whole vagina thing now. It's like, oh, does she have a great ass? Okay, good. I'm good. So don't give us that much credit.
That's what gets you in.
But here's the question. Here's the question, Dr. Garcia. What about men that come to you wanting like calf implants?
Or butt implants.
Yeah. Or pec implants now. Like really? Pec implants?
I did one set of pec implants, and I vowed never to do them again.
Even you have your limits.
Yeah, I know. I did them. It was 20-some years ago. I did as a young kid. He was very, he went on that side of the fence, and he just didn't like to be in the gym all the time, but he didn't have any muscle, and I put him in there, and just like a girl that's getting breast implants for the wrong reason, he was never happy. He looked great. The problem was he looked like he was always flexing. And, it's because you can't, the thing doesn't contract. They're made out of solid silicone. So it's like, imagine going to Victoria's Secret and getting one of those, boob inserts and stick it in underneath your muscle.
Well, he's like a Ken doll. He's a 24-hour Ken doll.
Right, yeah. It's just like that guy that...
Well, I guess one benefit is if you get shot there, it's not going to go...
Right, the fragments won't go down. There was one lady that got shot and her breast implant stopped the bullet.
Wow.
But I wouldn't count on it. Continue to wear my ceramic vest.
Yeah,
that's... to get them, that's for sure.
No.
Yeah, that's why they make plate carriers. I'm just going to take my chance with that, man.
It's, anyone that comes in for that, on the torso, shoulders, delt implants, bicep implants.
Right.
I say, listen, you got to come back and you got to show me you've seen a psychiatrist for 6 months. Because you've got a serious issue. I don't want to do a surgery that can cause you problems until it's the same thing when I do, gender reassignment patients. They got to live the opposite sex for 2 years, be on hormones of the appropriate fashion, and their psychiatrist has to give me clearance.
Yeah.
Because otherwise,
there's no going back.
Literally. It's and the weird thing is, 80% of the guys that turn into women keep the penis. I never understood that.
Yeah.
It is it's kind of like they want to keep something
to remind them who they were or something.
Yeah.
Right.
But what are they going to do with that?
I wonder if there's, there has to be at least one case of this, but I've never heard of it. But I wonder if there's ever a case of someone who got a sex change and then decided, oh man, this was a big blunder.
No, let me tell you.
Oh, that happens. No, that happens.
Yeah. I've read them in the research and medical journals. It does happen. You can, in certain instances, go back, but I can tell you, rebuilding a penis is a very challenging operation. It'll work. Your sensation's never going to be the same, it's doable. We learn from guys that were injured in accidents where they lost their penis, and basically what you take the radial bone out of their forearm, some skin, and you form a shaft out of that, and then you just attach it to the nerves at the end of their, the clitoral nerves, the nerves in that skin. So they look like they have a penis. They can pee through it. They could actually have intercourse, but the sensation, you can't ejaculate, obviously, so which kind of baffles me, because when are you going to show that?
Yeah, right.
Yeah. Constructed. But again, it's one of those things. It's it's a lot of weird stuff out there, man. That's all I can say.
Yeah.
Ample opportunities for me to find surgical patients.
Yeah. I think it's smart though with the counseling. Is that something that you legally have to do, or is it something you do?
Something I do.
Yeah, that's smart.
It's just, and I tell them, it's for your own benefit. I'm here for you. You got a question, and if we go through this, we all want to be doing this as safe as possible. Because a lot of them come in on a bunch of antidepressant stuff. And actually any patient, not just the transgenders, but any of my patients that's on antidepressant medication, they got to bring me a letter from the doctor that prescribed them, telling me what is it that you're giving this person these drugs for, and because I want to make sure that this person can read the consent and give me permission in the right state of mind.
Right.
If they're depressed, I don't know if I want that person signing a permission paper for me to do surgery on them.
Yeah. Right.
I think, so, and some of the doctors don't want to do it. I go, well, I'm not going to do your surgery then, because this is hard, fast rule. And
I think making a decision like that in a depressed state, just asking for trouble.
Yeah, because you're pretty much making a decision under duress. Okay,
right. Exactly. And what I do really is psychiatry with a knife. People want to feel better by something I'm going to change on their body, and it should be the other way around. You know, you have something in your mind, and that's what causes you to change your body. I mean, it's not, you know, and that's why we go to the gym, and it just happens, you know, like Mike said. But if you've got a difficulty that you can't come to grips with, surgery is not going to fix it.
Yeah,
it just doesn't. Maybe electroshock therapy, you know, but you know, a set of implants isn't going to fix your problem. It's not going to help you keep your husband. It's not going to bring the husband that left you back. And they come in here because they see their husband is now going out with a girl who's younger and all that. And you get that. And that's why I tell them, women divorced, you know, come back in 6 months. 6 months after divorce, we'll talk about it again. Because you catch them in that 6 months right after their divorce. Oh, my God.
Oh, that's an extremely emotionally fragile state,
exactly.
to say the least.
This is a whole lot.
Husband or whatever.
Exactly, because that's a big why period at that time. It's like you're just constantly asking, why did this happen to me? Why is this? Why? And the thing is, it's one of those situations where you're not in a position to try to answer that on your own. You know, so you're that's above your pay grade to try to answer that at that point.
I'm not smart enough to do that.
You know,
I can't answer that question. No way. Not a chance. Not a chance. So.
Awesome.
Well, hey man, it's been great having you on.
Yeah, I loved it.
Yeah, we won't keep your whole day occupied here. Love to have you come back sometime.
Oh yeah,
whenever you want.
Talk some more of this.
Just down the street, we can talk about any topic.
Yeah, it's fascinating.
We can make fun of Philippi if you want for now.
I think making fun of Dr. Pierce would be more fun.
Well,
that might get you in trouble over there. It's easy, that's for sure.
Go at us sometimes. We have fun.
He's the butt of a few jokes over at PSI.
Well, I mean. Yeah, that's what happens when you have girlfriends that are bigger than you are. I'll tell you a funny story because he and I volunteer before we get up. We volunteer with the SWAT team. So
right.
And we do that. So we have to pass a physical fitness test every 6 months. And a couple years ago, he was seeing that one girl that you know, and it was a Saturday, and he wanted to go run the obstacle course just to make sure he could do it, you know, because the test was coming up 5 days later, and the girl was with him. So he did it, you know, and he passed according to our standards. And that girl ran it and kicked his ass.
I bet she did.
Oh, I mean, right. I mean,
she could do some strongman competitions.
She was a beast.
Yeah.
And he was embarrassed because she just did not hold back, and everyone else was there looking at him like.
I wouldn't be embarrassed. She weighs more than I do.
Yeah, her testosterone levels are higher than yours.
I would expect it. I was like, you should perform better than I am.
You're getting your money's worth, girl. Oh man.
Now with the SWAT team, you do ride-alongs where if someone gets injured, you help them out, or what's the purpose of that?
We work like military medics. So
we
get into the hot zone. So where the ambulance guys can't go, that's where they put us to get the person out of the building and provide medical care to stabilize them until we can get them out of the building and take them down to the ambulance and that stuff. But hell, I mean, it's a blast. I mean, I've been doing it 15 years now. It's a busy SWAT unit here in Vegas. They actually serve more warrants than LA County does.
Oh.
I was out last Saturday from 9 o'clock at night till 10 o'clock the next morning. Had a jumper at the Venetian that jumped off the side of the building, and then we had a guy that was on Spice who had an AK-47 that wanted to kill people. We had to go get him. So but see, that's for me. It's great because my practice is so many females. So when I get to hang out with the guys at the gym or with the SWAT guys, I get reinvigorated there.
Yeah,
it's good.
That sounds like a reality TV show.
Yeah, exactly.
Doctors on SWAT.
Some pretty crazy stuff, I gotta say, you know. But I love it. They let me do everything that they do. They put me through the SWAT school so I can jump out of helicopters and rappel down walls and shoot guns. So it's, you know, because I go in with them. I got a bulletproof, you know, gear and a whole thing. So it's a gas. It really is.
That's pretty cool.
G.I. Joe at my age, you know.
What are your training goals that you have right now? We'll leave with that.
Well, you know, I'm at a 500-pound deadlift right now.
Oh, great!
Nice.
So I want to see if I can get that up to 525, 550 by the end of 2016. And I have some limitations. I got a lot of old injuries, so there's things I can't. But Philip, always manages a way to find something for me to do.
Well, he's a master of that, definitely.
Yeah, but I'm known as the kettlebell guy. Whenever we do metabolic, I always put some kettlebell stuff in there. I should show you guys some of my kettlebell workouts I've come up with these guys on for metabolic conditioning. They hate them because it's hard stuff, but the 100-pound kettlebell that we use for metabolic training is awesome. So
the Metcon workouts there are tough in general.
Yeah.
Everybody hated those.
Wheel and spoke is the thing now. We get 8 exercises. One's in the middle. You do the peripheral exercise. You go to the inside to the circle. You come back out. You go back inside, and then you do that one round, and then everything gets switched over. So when you got 8 exercises like that, you get 2,400 reps, I think it is, because we were doing, and you're trying to get in there under 25 minutes. So you're cooking. And it's those kind of workouts like you guys have, where at the end you sit down on the ground, before you know it, you're lying on your back, trying to get your air, because but it's you got 8 guys going. There's only one station open, and the guy's chomping at you. He's on your tail, so you got to run.
Yeah. I mean, even some of the warm ups are tough there. I remember when my friend Tim Larkin started working out there for a while. He would go through the warm-up period, and he would be on his back sweating. People would be like, "Are you okay?"
Tim's in good shape.
He's in good shape, exactly.
Yeah. Jeez Louise, he's a good guy too.
I would find clever ways to get out of those warm-ups. Mark would be like, "Okay, we can put you through the warm-up, or you can go get on the power plate." I was like, "Yeah, I think I'll do the power plate today." And I would just do that every time. I'm going to go do 10 squats in the power plate. That'll work.
That 6 minutes of core training is like. What?
Yeah, I hated those warm-ups.
Yeah, at the beginning of the warm-up, you got to do them at the beginning, because he knows you're not going to do them at the end. You're going to walk out, so he makes you do them at the beginning.
My warm-up is walking in the gym. I walk in there, I get going. That's my warm-up.
Aryan method. Just bend over and lift something heavy.
Yeah, it's functional, right? It's like, you need to warm up before you do this. Then how do you know you can do it in a real-life situation? You're not going to have time to do all this mobility stuff in the real-life situation.
You've been on the show with me far too long, Mike. My philosophy.
Exactly. But no, guys, anytime you guys want me back, I love you guys. I love your show. You guys are legit. I wish there was more people like you guys out there, but someday I think you're influencing enough that people like you will start multiplying out there. And I wish you the best. You guys are inspirations to me, both of you, and love your show.
Appreciate it.
I really appreciate that. Thanks a lot.
What's the website where people can find out more about what you do?
Yeah, easiest one is it's lvcosmeticsurgery.com.
Okay.
There's a link there to the stem cell site if they want to go there. So for sure.
Mm-hmm. Yeah, sounds great.
All right, guys.
Thanks again.
Awesome.
Pleasure. Talk to you soon.
Take care.
Good one.
Thanks. Bye-bye.
Bye. And that again is our friend Dr. Julio Garcia. Definitely check out his website. The stem cell stuff sounds really interesting.
Oh, yeah, it was,
I'm
man.
going to look into. Yeah, I'm going to look into that more as, if nothing else, just something interesting to talk about on the show.
Yeah.
Just check that out, try it out. I like to be informed on different therapies that are effective out there. And one thing you should be informed on doing is leaving us a review. We have thousands of listeners, and we have 192 reviews on iTunes.
And 50 Patreon supporters at the current moment.
Yeah.
This is jacked up numbers, man.
We should have 1,000 reviews on iTunes by now,
right,
given how many listeners we have. So go over to iTunes, leave us a review. Go to Stitcher, leave us a review. Share episodes on Facebook, share them on Twitter, and most importantly, use coupon code LLA to go support us. You can go to mikemahler.com, get 10% off all of the best nutrition supplements out there, videos, ebooks, you name it. And how about with you, man?
Yeah, you can get the same thing at newwarriortraining.com. 10% off of everything over there, ebooks, DVD, weight management 101 program, coffee stands for all you coffee lovers out there. You can get 10% off all of that. Hey, man, holidays are coming up, so shop with us, because we actually have stuff that people that you shop for and give gifts to will actually appreciate what you're giving them, instead of another pair of freaking socks and ties and other boring things such as that, or a Christmas card. Like, come on, man. Somebody stop killing trees and buy our products. It's like, really? Because all they're going to do is throw that away. Whereas with our products, they're going to actually utilize those and thank you for it when they start feeling better, and it actually enhances their lives. And then guess what? Now you're the hero. you're that guy, you're that chick now. So
So don't be the zero that listens to our show and never does anything to support it. If you're not going to buy some stuff from us, the least you can fucking do is go to iTunes or Stitcher and leave a review.
Yeah.
Or you can fuck off completely. That's another option. You can stop listening. That's always an option. We don't mind at all.
Oh, man. So, yeah, there you go, folks. So another great episode. So keep it locked in. All right, folks. Take care.
Take care, everyone.